Thanks, everybody. It's a pleasure to be here today and talk about something that I'm really very passionate about. I'd like to first start with talking about fear. Everybody has fear. I don't know a person that doesn't own a fear. And psychologists and people who do research on human behavior say that fear is a very big motivating factor. We don't speed on the highway for fear of getting a ticket. Let's face it, we don't not speed because we want to make the highways safer, we just don't want to get a ticket, right? Fear of drowning led me to enroll my children in swimming lessons when they were very young. We live around a lot of water. Some fears are healthy, right? So like the fear of not falling to our deaths will dissuade most of us from not attempting a solo free climb on El Capitan, right? That's a healthy fear. That's a very reasonable fear, right? But some fears are unhealthy, okay? Fear of failing keeps us from trying. Fear of being rejected makes us not want to invite that new friend out for coffee or that family over for dinner, right? Some fears are not healthy. Fear of cancer may cause us to not go in for recommended health screening, to not see our doctor, to not schedule that colonoscopy or have that mammogram. Some fears are unhealthy. And what I would like to invite you today is to get rid of fear, or as least fear as it relates to cancer. I'd like us all to take a moment and say cancer out loud. Ready? 1, 2, 3. Cancer! Okay, great. Good job. That's the first step. So, we fear cancer, and I think that's an understandable fear because fear, cancer makes us feel vulnerable, right? I'll tell you a story about when I felt the most vulnerable in my life. And I think many of you in the audience might relate to this because I think there might be a lot of mothers in the audience or people that have godchildren or something. And do you ever remember sitting and holding that baby in your arms when they were so new, right? And they seemed fragile. And I remember doing that. I remember holding my baby girl and looking down at her and going, oh my God, I hope I don't F this up. This is really scary, right? And so, but I looked down at her and I embraced her and I embraced that fear and I looked at all the potential ahead of us. I'm like, we're gonna do this, right? And she's 16 now and she's doing pretty well. So I think fear and vulnerability are very relatable human emotions, but they're not healthy when it relates to cancer, okay? And I'm gonna try to convince you of that today and tell you some things that you can do. So our bodies are really complex living systems. I'll never forget the first surgery that I was in on. I'm a surgeon, I do this all the time now, but that first surgery, when I was allowed to not even really do anything, I just had to watch, and the scrub nurse seemed really intimidating and mean. And so I remember going, oh my gosh, you think people are complex on the outside? You should get a look on the inside. It's amazing, it's amazing. And even to this day, having done thousands of surgeries as the primary surgeon, I'm still totally amazed by the complexity of the human body. There's the fact that on most days and most people, everything works together and is integrated and there aren't any problems is nothing short of miraculous. And when you look inside a human body, and you can't even see those cells are there because they're so small, and then there's all these chemical neurotransmitters and electrical impulses, man, if that doesn't make you think about a higher power or a greater meaning, I don't know what will, right? It's amazing. And the reason why it all works together is because of our DNA. Our DNA is a complex set of instructions or a big blueprint for how all of our cells are supposed to be made and work together and function, right? And this blueprint gets copied over meticulously and miraculously every time one cell divides into 2, and then 2 into 4, and 4 into 8, you get it, right? And if you ever tried to copy something or send a text, right? And you know that mistakes happen, right? Right. And even though our bodies have a kind of an autocorrect, we all know autocorrect doesn't always work, right? sometimes the message just doesn't say what you intended it to say, right? In our bodies have a kind of an autocorrect too, but it doesn't always work right. And what cancer is a mistake. It's a mistake in your DNA. And each one of us probably has millions of mistakes in our DNA. You're like, oh, and so am I saying everybody's going to get cancer? No, that's not what I'm saying at all. Because there's a lot of our DNA that's really not that important. It's kind of like filler. It's kind of like bubble wrap around the important stuff. And if the mistakes happen in the filler, then nothing goes awry. But when the mistakes happen in the important parts, sometimes that gives rise to uncontrolled cellular growth, a moving past the normal stop mechanisms, and a tumor may develop, a cancer may happen. So does this sound all a little random? Millions of mistakes, some important, some not important. Maybe it won't. Yeah, it is a little random. Most cancer arises because of sporadic mutations in our DNA, which means it's something we can't control. And I don't mean that to be scary. I'm just stating facts, okay? But there are things that you can do to know more about your personal risk factors, to be aware, to get the appropriate screening tests, so that if cancer does happen, we find it at an early stage when curative treatment can be very effective and that you can go on to live a healthy life. As a cancer doctor, I've known people that have had cancer 3 times and they're actually healthy, right? So it's not a death sentence, okay? So a little bit about risk. Risk, simply put, means knowing how likely something is to happen, right? So the average woman's risk of developing cancer in her lifetime by the time she's 80, any guesses? 1 in 3. 1 in 3 women will get cancer in their lifetime. How likely are you to die of cancer? Statistics show in the US, 1 in 5. All right? So that means that most women won't get cancer or won't die from cancer. Okay? All right. More statistics for you. The top 5 cancers in women: breast, lung, colorectal, uterine, and thyroid. Okay? Those are the top 5. Now, importantly, the risk of a lot of cancers is actually slightly decreasing over time, except for breast cancer, colorectal cancer, and uterine cancer, which have shown a slight increase in risk or incidence, okay? So again, just some statistics. But the fact that cancer death rates are decreasing because of better screening and treatment, again, makes this a very hopeful situation, okay? So I'm going to talk about some of the top cancers and sort of things that you should know and things that you should do, okay? Or at least some recommendations. So breast cancer, the most common cancer in women. The risk is about 1 in 8 by the time a woman reaches the age of 80. But at 30, it's 1 in 227. At 40, it's 1 in about 68. At 50, 1 in 42. You get it. So age is one of the biggest risk factors for developing breast cancer. Okay? Another risk factor, being a female, right? Risk is 1 in 8 for women. It's 1 in 1,000 for men. So the 2 top risk factors are being a woman and getting older. Can you change that? No. No. Other risk factors would be history of radiation to the chest area when you're a young woman in your 18 to 20-year-old range because of maybe a lymphoma. Those patients need to be aware so that they get appropriate screening. Other things would be breast tissue density on mammogram, being overweight or obese, prolonged hormone replacement therapy use of estrogen and progesterone, as per the Women's Health Initiative, as Dr. Rice talked about. So those things are things that can slightly increase your risk. Family history is also important, but importantly, most women who develop breast cancer do not have a significant family history. That means if we don't have anybody in our family that's had breast cancer, we're not off the hook, okay? All right. Let's move on a little bit. What about colon cancer? Risk of lung cancer. Risk of lung cancer in women. In your lifetime, 1 in 16. It's actually the same as the risk of lung cancer in men. Biggest risk factor? No surprise, right? Smoking? Right. Smoking accounts for about 80% of lung cancers in women, all right? Other risk factors would be a workplace exposure like asbestos, high-dose radiation for treatment of other cancers, repeated CAT scans, things like that. There's no recommended screening tests for non-smokers because the risk in non-smokers is so low. But if you have had a significant smoking history, and even if you've stopped, but it's in the last 10 to 15 years, you may want to talk to your primary care provider about low-dose CT scans for lung cancer screening, because these have been shown to be effective for finding lung cancers at earlier stages when there's potentially curative treatment. Okay? Colorectal cancer. So colorectal cancer incidence is about 1 in 24 for the average risk woman. Colonoscopy has been the gold standard for colon cancer detection. But there are some newer, less invasive tests that are coming around, and you might want to talk to your primary care provider to see if you're a candidate for those tests. I think knowing some other risk factors like a family history of colon cancer or a personal history of colon polyps, those things can actually increase your risk for colon cancer, so you may want to start screening at a younger age or have screening more frequently. Again, that trusted primary care provider can be a great advisor for you on a colon cancer screening. One word about colon cancer incidence, though, is that it's actually the age of onset. It seems to be lowering, which is interesting. So the American Cancer Society recently changed its recommendations to start colon cancer screening in average risk people down to the age of 45. They used to say start at 50, right? I mean, many of you may remember that. But actually, we've seen more colon cancer deaths in people younger than age 55 now than in years past. This is, again, likely related to diet, obesity, and inactivity. So that's something you want to be aware of. What about uterine cancer, the 4th most common cancer in women? Uterine cancer risk is about 1 in 33. So again, it's pretty low, right? So we don't recommend any routine screening tests for uterine cancer. But an early sign of uterine cancer in postmenopausal women can be vaginal spotting or vaginal bleeding. That doesn't always mean that it's cancer. You could have a uterine polyp or some other benign condition, but you don't want to ignore that symptom. You want to go into your primary care provider or your OBGYN and say, look, I need to have this symptom evaluated. And again, take fear out of the equation. You see something, say something. Go get that symptom evaluated. It could save your life. Interestingly, uterine cancer, when it's caught in an early stage, the cure rates are really high. It's like 85 to 90%. So if you're worried, go in. I've talked a lot about average risk for cancers and what you should do if you're at average risk. But what about if you're not at average risk? Or how would you know that you might not be at average risk? Well, it all goes back to the DNA thing again. Remember that I said that a lot of these mutations are sporadic, they're just by chance. But some mutations are inherited, right? So we each have a mom and a dad, right? Half of our DNA or our genetic blueprint comes from mom. Half of it comes from dad. That means family history on both sides is equally important. I see some patients that think, well, I can't get breast cancer from a gene mutation from dad. Actually, you can. So you want to know both sides of the family equation, the family history, okay? So an inherited mutation might be something that is passed down from father to daughter or mother to daughter and can actually be associated with a hereditary cancer syndrome. So what you want to do is collect family history data. Just casually ask who in your family's had cancer. I think we're in a more open society now where people are more willing to talk about this. And you want to know what kind of cancer they had and how old they were when they had it. And while, of course, death of a family member is very important and very meaningful, it's actually not important if the person really died of the cancer. It's the actual fact that they had it. Because remember, I've told you that a lot of times if cancer's caught early, people can be cured. but that family history is still important. And you want to look for some red flags. And the healthcare professional that's really trained to look for these red flags is somebody called a cancer genetics counselor. So if you've got cancer in your family, you may want to make an appointment to see a counselor. They're going to look for red flags. Red flags are a sign that you may need to consider some genetic testing. Red flags are things like having a rare cancer in your family, like ovarian cancer or pancreatic cancer, right? Or cancers that happen at a young age. Remember, we said breast cancer in a 30-year-old is not common. So if you've got that family history, that's something that you want to make note of, okay? So armed with this information, talk to a genetics counselor, see if you should be a candidate for genetic testing, right? And then if you are found to have a mutation, know that that's not a death sentence, right? It's about knowing your risk, okay? And maybe you need to have screening a little bit more frequently than the average Jane. Maybe you need an extra test in addition to your mammogram. Maybe you need an MRI. But remember, if we catch cancer early, it can often be cured, all right? Yeah, take the fear out of the equation, okay? So some things you can do. Know your risk. Get your family history. Healthy lifestyle things. Don't smoke, right? Or if you're smoking, try to stop. Get help from your primary care provider. Healthy diet. Exercise, right? We've heard a lot about exercise today. Overweight and obesity accounts for increased risks of some cancers. So again, that we've heard a lot about that today, about exercise and mindful eating, all things that are really important. And get your screening tests. Know which ones are applicable to you and know the interval and get them done, all right? I wanted to share a quick story. I know I'm kind of running low on time, but I have a quick story for you. And I got this, I called up one of my patients and asked her if it would be okay if I told this story. So she's a young lady. She noticed a little change on her nipple. She went in to see a dermatologist who said, oh, don't worry about it, it's nothing. And time went on. She's a really busy mom, really devoted to her children, more devoted to her children than taking care of herself, which happens to a lot of us, right? And the skin changes spread onto her areola. And they got more and more progressive. She was 49. She didn't have a primary care provider. She hadn't had a mammogram in about 5 years. Things progressed. She developed lumps in her breast. And she came in to see me. And I looked at her and I examined her and I talked to her and I was pretty sure that she had breast cancer. And that was confirmed with a biopsy. She's doing great today, but she had very involved treatment. She had 4 months of chemotherapy, she had surgery, she had reconstructive surgery, she had radiation, and a total of a year of IV antibody therapy for her particular type of cancer. And she's doing great today. Just talked to her the other day. She wanted me to share her story. If you see something, say something. Be your own advocate. Know your risks. Don't let fear paralyze you. And you have the power to change your life. Thank you.